Even though COVID cases are rising at an alarming rate here in our state, Governor Cooper says he is not implementing new mask mandates.
He wants to leave it up to local communities to make that decision. Our Capitol reporter Michael Hyland is live for us in Raleigh.
And Michael, it's been inconsistent even within some counties when it comes to this.
Right. I asked him about the confusion surrounding that, as well as the state's plans to coordinate getting booster shots to people later this year. COVID-19 cases are accelerating at the fastest pace since the pandemic started. That was the warning from state health officials Wednesday as communities decide whether to mandate masks again. Even within Wake County, it's been a mix of some that do and some that don't. Is this piecemeal approach really an effective way to deal with the surge that we're experiencing right now?
People know what to do to protect themselves, and what we see is, I think, mandates at a local level are more effective because there is more buy-in.
Cooper said the same thing about schools as some leaders reverse course and are now requiring masks. He's urging those where it's still optional to change their minds. Cooper says with vaccines available, the state is in a different place. On Wednesday, the federal government said starting September 20th, people who got the Pfizer and Moderna vaccines will become eligible for booster shots.
I think people need to be patient.
Dr. Ritesh Patel is a pharmacist who's helped coordinate vaccination events all year. He expects that to look different with the third doses. He wants the state and counties to get those doses to as many providers as possible.
I think we're able to hopefully learn from those, earlier on larger clinic sites where there's a lot, 4 or 5 hour lines to be able to get to, multiple different locations in the same area.
Dr. Mandy Cohen said the improved supply of vaccines will help with that too.
I think we're in a different place than we were at the beginning, where we have a much more robust pharmacy program in terms of being able to vaccinate, as well as doctors' offices.
Dr. Cohen said the state is still looking for additional guidance from the federal government on rolling out the booster shots, including whether people are going to be prioritized in the same order they were the first time around, or if there are going to be any changes with that. Live in Raleigh, Michael Hyland, CBS 17 News.